Hi everybody, welcome to another episode of Dear Derm. I'm Dr. Mona Gohara. Today we're going to be talking about all things psoriasis. We have a very special guest, one of our Well+Good viewers, who sent in her skincare routine. So we're going to look at what works, what doesn't, and what treatment options there may be for anybody at home who may struggle with the same condition. Psoriasis is one of those inflammatory skin conditions that can happen anywhere from top to toe. Most commonly, people get red scaly plaques on their elbows, knees, or even their buttocks. That being said, it can affect almost any part of our skin, even our fingernails and hair. One of the most important things to remember about psoriasis is, although it's not curable, it's very treatable. And today we're going to talk about all of those options.
Hey there, I'm Annie Burgess, and I am going to walk you through my morning and night routine. One thing I do have to be careful about is a couple years ago I was diagnosed with psoriasis, and it's odd because I used to think I had horrible dandruff, and I went to the dermatologist and they said, no, you have psoriasis. And I just use a topical ointment that's prescribed, and that actually really clears it up on my scalp. But I definitely find that if I'm really stressed or just sometimes just due to seasonality, I get patches of psoriasis on my lower back or in other areas of my body.
Hi Annie, I really appreciate you sharing your skin routine with us. So you mentioned that you have some flaking on your scalp and some inflammation on your skin that can happen either seasonally or with stress. This is completely normal with psoriasis.
I just came home from work, and so I'm gonna take off my makeup while we go through the routine. So I use the Botanical Bee One Love cleanser. It's an oil, and this is what removes my makeup. And then I follow that with an Indie Lee brightening cleanser. I love the smell of this. It smells amazing. And I follow with Folane toning mist, and then Folane moisturizer. These don't have any scents, and they're for normal and all skin types.
I like the fact that you're using a gentle cleanser when we scrub our face, or we're using really harsh soaps and cleansers, or rubbing really hard. That actually may make room for psoriasis to come out more. I also love the fact that your toner mist and moisturizer were fragrance-free. Fragrances, as much as we love them, can actually act as skin irritants in many situations. So, particularly when we have inflammatory skin conditions such as psoriasis, we want to make sure that the skin barrier remains intact and isn't irritated, so it can do its job at fortifying our skin and keeping it protected from further inflammation.
If there's any recommended body washes, I'm all ears, or any other recommendations you may have.
I personally recommend gentle cleansers for all of my patients, whether they have inflammatory skin conditions or not. One of my favorite is the Dove body wash. I also like brands like Vanicream. Both of these brands just help to make sure that the skin doesn't become more irritated, and if it's not irritated, keeps it healthy and calm. So psoriasis can have many different manifestations. That being said, there are many different treatment options. Let's start at the beginning. One of the things that you mentioned, Annie, is that you have an ointment for your scalp and body for when you flare up. That's pretty typical. Ointments, generally steroid ointments, sometimes vitamin D derivatives, help to decrease the inflammation associated with psoriasis. They're great if you just have a small amount, or if you don't break out with psoriasis that frequently. Many of my patients don't want to put ointments in their hair because sometimes it's too greasy or it affects their hairstyle. So in those situations, there are other options. When topical medications don't work because they're not controlling the skin condition or they're too much to put on, we move up the treatment ladder. The next step would be consideration with ultraviolet light. Now, we don't recommend that you go outside and tan or go into a tanning booth, but a dermatologist can actually prescribe for you the ability to go into our version of a light box to help decrease the inflammation associated with psoriasis. If that doesn't work, the next step may be oral medications that can help to decrease involvement with psoriasis. Now, I would say that the oral medications, of which there are many, have a 50-50 benefit. Sometimes people have great results, sometimes people see no results. Our ace in the hole treatments are a group of injectable medications called the biologics. These medications actually act against the very inflammatory markers that are creating psoriasis in the first place. They act at the cellular level. I consider biologics as a very important option and a very important part of our treatment regimen when it comes to treating our patients who struggle with psoriasis on a daily basis. Some people may choose to go on a biologic if they have 1 or 2 spots. Others may choose to go on a biologic if they have their entire body covered with psoriasis or an area that's difficult to treat, like their scalp. I want to emphasize that going on a biologic is a truly independent and individual decision that I would back as a dermatologist in most instances. Why? Because they are one of the few ways that you can actually put psoriasis to rest for many years, if not life.
So, thank you so much.
Annie, you are doing such a great job with your psoriasis and your skincare routine. I applaud you. And I really applaud you for just bringing awareness to people who may be struggling with psoriasis privately. I want to encourage all of our Dear Derm viewers to go see a board-certified dermatologist to explore all treatments for psoriasis, including possibly biologics. Thank you so much for watching another episode of Dear Derm. And for any additional skincare questions, make sure to subscribe to Well+Good. See you next time.